Director Dr. Rosmond Adams believes that public health measures to tackle the spread of COVID-19 can be a setback to HIV and AIDS patients' ability to access health care. Speaking via a virtual interview with NCN News, Adams stated that while people living with HIV and AIDS are at risk of contracting the coronavirus, limited access to care and treatment in the present circumstance can pose a challenge.
Also, when you look at measures such as quarantine and curfews being put in place, it means that our work hours where we can really do work have been reduced significantly. And so even when we try to work at home to readjust, it is just not the same in terms of having the person-to-person relationship, working relationship, where we can push to implement a number of projects and a number of activities.
Dr. Adams believes that a new policy direction among public health agencies and civil society organizations in the region is needed to preserve the work done against HIV and AIDS.
Certainly, we have to push for ways in order to work around these measures that have been these public health measures that have been instituted. So we may have to look at, say, multi-month prescription instead of going every month, that someone who has to get medication.
The PANCAP Director also recognized that there is stigma and discrimination attached to persons affected by COVID-19. He called for this behavior to cease, noting that the experiences learned from the HIV epidemic can be applied to the fight against the COVID-19.
The way in which HIV have tackled this is that there need to be community-led interventions that tackle the issues of stigma and discrimination, and to really interrogate where are these issues coming from and how best that we can really solve the root problems of stigma and discrimination. Is it, around the disease because the disease is a pandemic? Is it because, of the mortality caused, or is it because of say, complications of the disease?
PANCAP was established by CARICOM heads of government in February 2001 in response to the threat of HIV to sustainable human development. It provides a structured and unified approach to the region's response to the HIV epidemic. Tracy Romalho for NCN News.